And talking about the cervicogenic headaches, how do you differentiate if the symptoms are coming from the upper cervical or lower cervical?
By definition, upper cervical is the only cervical segment that can give you pain in the head. Okay, so you cannot have headaches from C6. Okay, so the source is always the upper cervical if you're talking about cervicogenic. But you may have a contribution from the lower cervical. Let's say you have a loss of extension in the neck, and this is changing the behavior of the upper cervical. Okay, maybe the upper cervical is giving you the headache, but because the lower cervical is not behaving properly and changing the way this is suffering. So maybe you are having the afferents from here altered because of the lower cervical. Okay, but you are always, if you have headache from the neck, the source is going to be always the first three segments, the top three segments.
Okay, and how do you know that the lower cervical is influencing the upper cervical?
Okay, this is not always that easy, but when I'm teaching the courses, I'm showing a couple of schemes that shows you hints that can lead you to think, okay, maybe it's very, very upper cervical with a little or no contribution for the lower, or you may have some contribution from the lower. And it's related to the range of motion, okay? For instance, if you have a positive flexion rotation test, now you for sure have an upper cervical issue. Why? Because the flexion rotation test is assessing only the rotation on C1 on C2. Okay, this is the only segment is assessing. So if you have a positive test, now you know you have something not working properly. Okay, you still don't know if this is the cause, because to say that, okay, this is the problem, you have to change this to normalize the range of motion, and the patient has to say, I'm better. Okay, so there has to be a correlation between now I move better and I feel better. Okay, so there has to be a relationship. And if you have a lower cervical involvement, usually you have more movement restrictions. If you have the upper cervical only, maybe the flexion rotation test is the only range of motion that you find decreased, okay? But the maybe they are full and free, okay, pain-free. But when you have a lower, you usually have more than one movement alter with decreased range of motion, mainly rotations, extension of the neck, or even flexion. Okay, of course, lateral flexion as well. So you may have more decrease of the range of motions in the whole neck. Whilst in the upper cervical, you may have no symptoms at all. No loss of movement at all. Besides, you can have with the upper cervical problem, usually you don't have neck symptoms, and if they are present, they are really on the top, and not really bothering the neck. Plus, you feel mainly the pain in the head, whatever the area, okay, but in the head. When you have a lower cervical, you can also have only pain in the head, but usually you have more neck involvement, you know, going to the trapezius, traveling down to the scapula and things like that. So you may have other movements and other symptoms going to everywhere. Okay.